Bronies, Potterheads, Swifties, and Disnerds. What do all of these names have in common? Well, they're all the names of groups that you or someone you know might be part of. Humans love to be in groups. They make us feel like we belong, they make us feel valued, and they make us feel like our weird interests are accepted. Today on Brain Blooms, we are going to be talking about social connection, why social distancing is different from physical distancing, how social connection has impacted well-being around the world during the pandemic, and how you can take care of your social health during and beyond the pandemic. Social connection describes that feeling that you get when you feel like you belong to a group of people. It's the feeling of closeness that we have when we bond with other people. Beyond making us feel warm and fuzzy inside, social connection can actually improve our health. Research shows that experiencing social connection, so feeling like you belong to a group, can strengthen our immune system, helps us to recover from sicknesses more quickly, and makes us more trusting, empathetic, and cooperative. It might even, through a variety of processes, lengthen our lives. Talk to any psychologist and they'll tell you that humans have an innate need to belong, to spend time with other people, and to be valued by their friends, family members, and beyond. Given this, you might be wondering, well, what happens when people are not allowed or able to spend time together, like during the pandemic? Well, we're going to answer this in a few minutes, but first, we have to make an important distinction between social distancing and physical distancing. In some countries, like Canada and the United States of America, people are being told to engage in social distancing in order to reduce the spread of the COVID-19 virus. While many people have gotten used to the concept of social distancing as a term used to describe staying at least 6 feet apart from those who are not in your household, the authors of the World Happiness Report, along with members of the World Health Organization, argue that this definition actually belongs to a term that's called physical distancing. So with this in mind, I'll define physical distancing as the practice of maintaining your physical distance from other people. This term makes it clear that rather than cutting off social connections, individuals are simply required to stay physically apart. With so many people around the world engaged in physical distancing in 2020 as a result of the pandemic, researchers wanted to see how physical distancing impacted global population well-being. Since we don't know when our social lives will return to their pre-pandemic states, it's important to understand how our current social state is impacting us. This is exactly what the researchers covered in Chapter 6 of the World Happiness Report, which is exactly what we're going to cover today. To examine the way that the pandemic's physical distancing measures impact psychological well-being, researchers examined the emotions that were most prevalent in different countries at different points of the pandemic. In the US, they found that between January 2020 and June 2020, so after the first few months of the pandemic, citizens experienced one of the largest declines in life satisfaction that had been seen during the pandemic. In the UK, between March and May 2020, negative emotions like sadness, fear, and frustration became more prevalent, but they returned to their pre-pandemic levels in May. Feelings of loneliness, apathy, and fear, though, remained stable throughout the pandemic. In a study from France that surveyed people 3 times between April 1st and May 6, 2020, respondents actually experienced increases in health and well-being during the quarantine, and this was especially true for individuals who had low levels of exposure to the virus. So what explains these interesting and seemingly contradictory trends? The researchers proposed that there are certain variables that protect some people from experiencing negative psychological effects of the pandemic and social distancing, and there are some factors that put individuals at risk. These are risk factors and protective factors. When examining psychological protective factors, researchers looked at the personality traits that seem to predict certain health outcomes. In a US study, they found that being conscientious, agreeable, and neurotic was positively associated with engaging in physical distancing measures. So people with these personality traits were more likely to engage in physical distancing. Interestingly, extroversion, or being extroverted, was associated with less social distancing, but it was also associated with more positive affect or more positive emotions, less negative affect, so less negative emotions, and greater life satisfaction as physical distancing measures increased. Maybe this is because people who are extroverted, even though they're not able to engage with people physically, are still able to seek out communities online that they can engage with. Researchers were also interested in examining how positive psychology characteristics, or personality traits that promote well-being, affected how people would be impacted by physical distancing measures around the world throughout the pandemic. A study in Spain on 800 older adults found that having gratitude, resilience, and a harmonious family was associated with greater personal growth and a greater feeling that one has purpose in their lives. Studies from China also found a correlation between gratitude and well-being. One study from China in particular found that people who engaged in a flow state, so people who became so immersed in a task that it made them feel positive, this flow state was associated with greater well-being. Moving on to the social factors that promote well-being, researchers in the US and the UK found that having a greater sense of connectedness with others was associated with having greater life satisfaction. As you might expect, loneliness, on the other hand, predicted decreases in life satisfaction. In Austria, researchers surveyed over 900 participants in April 2020, and they found that having larger social networks caused less stress and less worry during the lockdown. Researchers take this finding to mean that maybe having a team of friends protects well-being during the lockdown. Next, researchers examined the behavioral factors that can promote or protect well-being during the pandemic, and their results were kind of interesting. In the UK, participants experienced greater life satisfaction on days when they were volunteering. In the US, engaging in pro-social behaviors, so helping others and generally being a good human being, gave people greater feelings of social responsibility and a bit of anxiety, while receiving pro-social behaviors made them feel a greater sense of belonging and less depressive symptoms. Now, when it came to social media use, research that was conducted on over 1,000 social media users in Italy found that using social media to express emotions or to overcome hardships was associated with greater post-traumatic growth and more pro-social behaviors. But as you probably know, using social media doesn't result in only positive effects, unfortunately. In another study, using Instagram boosted life satisfaction, but it also increased negative affect or negative emotion. Researchers also wanted to know which daily activities boost well-being during the pandemic. Researchers in Ireland found that doing more outdoor things like walking or exercises resulted in more positive and less negative affect. Other studies support the finding that exercises boost well-being. And when it came to relationships, researchers found that spending time with family and friends, or even having a pet, could protect against loneliness. Researchers also established a few things that could put people at risk of having low well-being during the pandemic. They found that having an intolerance for uncertainty, so not being able to handle the unexpected events, predicted several poor health outcomes like fear and rumination. And rumination is simply the process of thinking the same thoughts, often negative when we talk about rumination, again and again to the point where it prevents you from achieving emotional stability. They found that having pre-existing mental health conditions might be related to worse well-being, although more research is needed here. They also found that people who had poor social support experienced worse mental health outcomes and experienced lower life satisfaction. They also found that people who had poor social support experienced worse mental health outcomes and reported having lower levels of life satisfaction. When it came to social media use, studies conducted in China found that social media use actually predicted some negative outcomes. Researchers believe that after the pandemic, more social media posts, at least in the site that was studied, began to use more negative emotion words, and as a result, this exacerbated the stress that users already felt during the pandemic. Can you relate? Are you seeing more social media posts that have negative wording rather than positive words like happiness and joy? So we spoke about a lot of well-being trends, and you're probably wondering, how can you cultivate the best social life for yourself so that you can stay healthy during the pandemic? Here are a few tips. First, be creative in seeking out social connections. Although many of us aren't able to go out during the pandemic, there are still many ways for us to broaden our social circles. One way to do this is by joining and being an active member of sites like LinkedIn. Join LinkedIn groups with people who share your interests, where you can send personalized invitations to people who share your interests. There are also sites like Lunch Club. Lunch Club is this really great AI-driven site that sets you up for virtual meetings one-on-one with different people who share your interests. So there are lots of different ways to get out there, even though you're not able to literally get out there. Next, you can boost your social health by maintaining contact with your friends and family members. Before the pandemic, it might have been easier for you to simply meet with your friends without having to schedule time in, but now that we're not in the same classes and the same neighborhoods as our friends, it's important to schedule time in. Call them to check up on them on social media. It'll be beneficial for both of you. And my last tip is to think about how happy you are with your current level of social connection. Think about what you like about the relationships that you have right now, how much value you're getting from them, and what you'd like to improve. Remember that it's more important to have high-quality relationships rather than to have many relationships that are not necessarily fulfilling. And if you don't have a network of people to reach out to, there are ways to find communities that you can derive benefits from. Again, Facebook and LinkedIn are great places to find those, as are places like Quora and Instagram. Of course, use social media with moderation and you'll get the best outcomes. So today you learned about what social connection is, how social distancing and physical distancing differ, general worldwide trends concerning the way that physical distancing impacted mental health during the pandemic, protective and risk factors for mental and social health during the pandemic, and ways in which you can cultivate mental and social health during the pandemic. This episode was created for the Psych 430 course at the University of Toronto, St. George campus. This video was produced and filmed by Joseanne Buchanan with the help of several great resources listed in the description section, and the curriculum was developed by Joseanne Buchanan based on the wonderful information provided in the World Happiness Report.